Okay. There's Dr. Coxio. Okay, Bethany Taylor. Okay, Dr. Hamza, you see, there is a 35 years age, right? This is what I was talking about. Okay, there should be an age or date of birth. One thing is definitely there. If you're not finding it, it means you need to look at it again. I'm writing to update you regarding Miss Taylor, who was self-admit. Okay, for decompensated schizophrenia is now ready to be charged for further follow. One thing, first thing first, remember there is no date in your what in your purpose. From last so many days we are discussing the letters, right? Did anywhere I have mentioned that you have to write the date in the purpose? No. I've been asking you guys about two things. You know those two things, right? Just write those two things. And I've been keep on emphasizing those things over and over again. There should be nothing else except those two things. If you write anything else, you are making your purpose worse and you are going to get less score. Okay. So please focus on that. Okay, there is no date in the purpose. If you want to write the date, see, you will eventually going to write the date next when you're going to explain that she was admitted and this is happened. Okay, what happened? Now you are going to mention this. These three lines is all about that particular date. So you are writing the date here, and again you're writing a date here. Would that look good? No, it won't look good. Okay. So when we write, we think we have written really good letter. But the problem is when someone evaluates. Okay, see, 1 3 2018, 1 3 2. Now, why would you write two dates, one line apart? Was experiencing visual and auditory hallucinations. Her behavior was aggressive and agitated, including thought block and latency, as she was not complying with her medication. The sentence is fine, but if you see, you have written the whole paragraph in one sentence. There, there could have been two, three sentences of this. Okay. I have no problem with writing these gigantic sentences. It's completely up to you. But the problem is these commas are not good. How many commas would you add? Hallucinations. Her behavior was aggressive and agitated, including thought block and latency, as she was not. Okay, so you could have cut the sentence into two. Okay, Miss Taylor was presented with visual and auditory hallucinations along with delusions. Her behavior, so you can end your sentence here. Her behavior was aggressive and agitated, and she was responding to no, she was no, and including thought block and latency. I forgot the word that was mentioned in the case notes. Okay, and she was not compliant with the medication. So that's fine. So you can cut them into two. During her hospital stay, she was commenced on risperidone. Now, the problem here is you have tried to, you have actually made the letter very overly concised, and this conciseness has is actually you have made it in a way which is really bad. Why? Let me tell you. This risperidone thing was mentioned in 01/03/2018 visit because these were the symptoms she came with, and then you prescribed the medication, and that was risperidone. So you could have very smartly written over up there with the medication, okay, like here, or even this medication non-compliance could have been written in the history because this is an update letter. In this update letter, you have to write two things in the history. See, I told you guys there is no history in update, but these two things GP might not know. Why? One thing is that she recently abused a substance, and this line was written with the date in the case notes. If you won't mention that because that was the recent substance abuse, GP might not know about that. So, okay, it's completely fine to mention that. And again, about the non compliance with the medication, this is also an history. Okay, so you can at the end, you can mention, please note, Miss Taylor has recently abused substance or re-abused or abused substance again. Okay, and she is non-compliant with her medication. So this one line could have been a history. Okay, you don't need to tell the GP she has schizophrenia from last 10 years because GP already knows, and she presented to you with decompensated schizophrenia. You don't need to tell okay GP that she has schizophrenia. Okay, the other thing, then you will write from this 10/03/2008 on this date, Miss Day, okay, oh sorry, Miss Taylor uh, had not reported, or Miss Taylor showed improvement in her symptoms as there were no auditory and visual hallucinations. Okay, and her thinking had become less disorganized. And again, the same mistake all of you are making. You guys are making what? Banana shake, and you're adding chili in it. Had not, has become. Okay, has improved, had not, has become, had displayed. Okay, I mean, see, these are some things which I've been telling you guys over and over again. Okay, in last 10 days session, I might have told you these things more than, not less than 50, 60 times. Okay, in every letter, if you go on to the all the previous videos, all are there on the YouTube. About 50, 60 times I would have emphasized on this with a lot of examples. Don't create a smoothie. This is my typical line. Problem is that all of you are doing the same mistake. Now, I am not someone like, we are not in a nursery or KG class where I will ask you, if you'll not do this, I will punish you or do this. No, I can only tell you, if you not improve, then my job is not to come and put a stick on your head and tell you that do this. Okay, because this is gonna cost you. This tenses mistakes, these are really bad if you'll keep on making those. Okay. So had not, has become, she is, then was, then had. I don't know how many tenses you're going to use. Okay. See, I will evaluate this further. But on the day of exam, if you do these mistakes, the person, the gura, okay, that particular person in Australia, because OET is from originally from Australia, they are not going to even look at your letter after reading has, had, his, was. They are done. They will fail you, give you 270, 250 marks, and will go on to the next person. They don't have time to waste on you. Okay. They have already charged 587 Australian dollars. Why would they care about you if you don't care about yourself? Okay. She displays no signs of thought block or latency. In addition to that, she is okay. See, she was able to focus on her daily activities. Her nursing management focused on her medication compliance and providing behavioral therapy when needed. Apart from that, she was regularly assessed for the signs of psychosis. It would be a, where is today's visit? See, doctor, we have discussed this today's visit just before this class. I have sent you some messages and I've explained that you have to write this way. This is going to be an update. This is going to be a discharge letter. How would you write this letter? You will write the purpose, the previous visits, okay, and then you will write today that she had showed satisfactory clinical recovery, right? You go on. go on to my messages, listen to my audios. The same line today she had showed satisfactory clinical recovery. You will see, sorry, you will hear this line particularly. You have not mentioned it. Like now, I don't have anything that I can add further because I cannot tell you guys how can I explain that this is important. Okay, sometimes see, sometimes I feel disappointed because I might think that I am unable to convey my message, or I might not be teaching good, or maybe there is something missing from my side that I am unable to convey, and that is why you guys might be making mistakes over and over again. But believe me, I'm trying my level best to change the way I teach so that you guys can get to know everything. The problem is that you guys are making the same mistakes, and this is not bad for me. Okay, this is bad for you. The worst that can happen to me is that you guys can break my streak. That from last 3 years, none of our students have failed in their writing. So you guys can, the worst that can happen to me is you guys can break that streak. I don't want to, but you might be. But the problem is that the it is gonna cost you a lot. Okay, you're gonna waste your time, money, and everything. And I'll be disappointed if you waste your money. I don't want to waste your money at all. Okay. So I literally have no word to say now because this is something, all the mistakes that you have made, all of these mistakes I've been telling you guys from last days, from last 10, 15 days. Problem is that if you make same mistakes, I cannot do anything in this.